Good morning, everybody. Hi, good morning and welcome. My name is Swathi Rayasam, and I'm a science associate at the University of California, San Francisco's program on reproductive health and the environment, otherwise known as PRE, and I will be one of your moderators during this panel. We are very excited to present a panel discussion on the week of the 5th anniversary of the 2016 Lautenberg Amendments to the Toxic Substances Control Act. And we're very excited to discuss this important law and how we can strengthen it to protect the public's health and prioritize the health of vulnerable populations. The UCSF Program on Reproductive Health and the Environment has been closely monitoring EPA's actions since TSCA was reformed and has been the only academic institution regularly submitting public comment to EPA, signed collectively by hundreds of scientists, academics, and clinicians. This past fall, PRE also developed evidence-based recommendations to help EPA put science and public health front and center, which were endorsed by 70+ topic experts and professional organizations. PRE's efforts have led EPA to reconsider scientific methods to assess hazards and risks that will ultimately lead to a more health-protective decision-making structure.
Thanks, Swathi. Hello and welcome. My name is Dr. Nick Charters, and I'm the Associate Director of the Science and Policy team here at the Program on Reproductive Health and the Environment. And I'm going to be your second moderator during the panel discussion today. The manufacture and production of industrial chemicals continues to increase, with over 350,000 chemicals and chemical mixtures registered for production and use worldwide, and thousands of these high production volume chemicals, so in excess of 1 million pounds per year, in widespread use in the United States. Data demonstrate widespread population exposure to industrial chemicals, and low income and populations of colour often bear the disproportionate burdens of exposure to these chemicals. Higher exposure to chemicals of concern have been associated with a range of adverse health effects, such as cancer, neurodevelopmental outcomes, asthma, diabetes, and reproductive problems, and all of which have been increasing in prevalence over the last several decades. As Swathi said, in 2016, Congress amended the Toxic Substances Control Act in an effort to strengthen the law and protect people from the impacts of these harmful chemicals. But unfortunately, the way the law has been enacted during the past 5 years, it has failed to use the best available science or prioritise vulnerable populations. During this panel, scientists and chemical policy experts will discuss what went wrong and what the key scientific issues EPA must address to improve how science is used to identify and prevent harmful exposure to protect people and communities, particularly those that are disproportionately harmed by industrial chemicals, by using the first 10 chemical risk evaluations as an example. This webinar is particularly timely, not just because it has been 5 years since the TSCA amendments were enacted, but also because over the past year, we saw the completion of the first 10 risk evaluations conducted under the amended law. So we now have a substantial body of work that allows us to see how EPA has conducted scientific assessments under this law. In addition, EPA is now preparing proposed regulations for these first 10 chemicals, which include dangerous substances which many of you know, such as asbestos, methylene chloride, and also trichloroethylene. We want to say a very big thank you to our co-sponsor, the International Society of Environmental Epidemiology, the North American chapter, and a special thank you also to Detroit Public TV.
Yeah, great. Thank you for that, Nick. And before we get into our panel discussion, we wanted to play a short clip about the 2015 opinion from the International Federation of Obstetrics and Gynecologists, or FIGO, about the reproductive health impacts and exposure to toxic environmental chemicals.
Everyone is exposed everywhere, every time, to toxic chemicals. The big challenge is to try to minimize these exposures.
It is in the food, the water, the environment, domestic pollution, industrial pollution.
There's been an over 15-fold increase in chemicals that are manufactured or imported into the United States since the 1950s. And that rise coincides with the rise that we're seeing in a number of different chronic conditions.
Doctors as well as the public, they are totally unaware of the influence of environmental toxin on an individual. For example, there are a number of people dying of renal disease prematurely at the age of 30, 35, 40, because 20 years ago they were pumping agrochemicals and pesticides, and it just went into the ground and spoiled the water supply. They didn't know what they were drinking, and now they are suffering from renal disease.
This opinion by FIGO is based on scientific evidence, and it's really important that obstetricians and gynecologists, who are the main physicians for women and women's health, are informed about the facts.
We have seen changes in cancer rates, thyroid disorders, miscarriages, large increases in ADHD, autism rates, deformities of the penis such as hypospadias, decrease in sperm counts.
At the 21st FIGO World Congress in Vancouver, 7,000 physicians, midwives, and healthcare professionals gathered to explore global trends in maternal and child health. A top item of discussion: how to reduce exposure to toxic chemicals worldwide.
Testicular cancer was going through the roof across Europe. And the hard evidence like that is, wow, this is serious.
We can't expect cures. We need to be much more thoughtful about prevention.
Many people just assume that chemicals must have been tested before they were released into the environment, and therefore they must be safe. And that really isn't the case.
There are different times during development and also as a child, adolescent, and as an adult that individuals can be exposed to toxic chemicals that can change the course of development or the ability to reproduce or the course of a pregnancy, and also can change human health, not only for the generation that is affected, but also for subsequent generations.
The science, physicians around the world say, can no longer be ignored.
There's been an explosion in our technological ability to measure industrial chemicals in people. And what they found was not just 1, 2, 3, 4, but dozens of industrial chemicals measured inside of people, in children and in pregnant women, so that babies are now being born pre-polluted with a number of different industrial chemicals that have been measured in cord blood.
We've got
We're now going to welcome our panel for today. First of all, Dr. Tracy Woodruff, would you like to introduce yourself? Thank you for joining us.
Hello, I'm Tracy Woodruff, and I'm a professor at the University of California, San Francisco, and director of the program on reproductive health and the environment.
Awesome, great. And we've also got Dr. Trish Coman. If you could introduce yourself, Trish.
Hi, everyone. My name is Trish Coman, and I'm a research investigator at the University of Michigan School of Public Health. Thank you so much to the organizers for including me in your panel today.
Great to have you. Thanks, Trish. And I am going to pass to Daniel Rosenberg from NRDC.
Hi, good morning or good afternoon. I'm Daniel Rosenberg. I'm the Director of Federal Toxics Policy for the Natural Resources Defense Council in our People and Communities program.
And last but certainly not least, I'm going to pass to Justin, who is a Detroit-based environmental organizer. Justin.
Hi, everyone. My name is Justin Amwenu. I'm an environmental justice organizer based in Detroit, previously with the Fiera Club, and I will be attending Columbia Law School in the fall as well.
Wonderful. Thank you, everyone. For everyone that is listening and watching, please feel free to add any questions into our Facebook chat at the end of the panel discussion today. We're going to be taking questions from the audience, so please, anything that you'd like to ask any of our panelists, feel free to do so. We're going to get the panel underway. Dr. Woodruff, I'm going to start with you. And if it's possible, could you give us a brief overview of the Toxic Substance Control Act and why we're discussing it here today?
Yes, thank you. I thought the clip did a really excellent job in talking about why environmental or manufactured chemicals are so important. There are many different manufactured chemicals, thousands of them, and trillions of pounds that are produced in the United States. And they can be in everything from our air, our water, our food, but also products that we use in our homes. So plastics like BPA and phthalates, perfluorinated chemicals, and nonstick and stain repellent materials, and food containers, glues, adhesives have chemicals as well. So, and as was said in the video, we know that these exposures to these chemicals can increase risks of many different types of adverse health outcomes. So the Toxic Substances Control Act, or TSCA, is the primary law in the United States that governs the management of manufactured and imported chemicals in the United States. So as such, it has a great control over whether these chemicals are used in these different products, and then ultimately whether we're exposed to them. So how the language of the law is written and its implementation will influence manufacture and use of industrial chemicals and our exposures, and then ultimately our health. So the original law was passed in 1976 under recognition that there were many environmental activities going on at that time, and it was clear that there was a lot of pressure to do something about industrial chemicals. But there was a lot of problems with the original law because of the way that it was set up, in that it had a significant barrier to collecting data, so data to understand where chemicals are used, how we're exposed, and how they affect health. And then there were significant barriers to regulating chemicals. So a classic example is asbestos, which is one of the first 10 chemicals in the updated law that EPA is evaluating. It's a known carcinogen, but EPA was not able to regulate it due to flaws in the law. So this was recognized actually quite widely by the federal government, by the public health community, even by the industry. There was different reasons why they wanted to see an improvement in the law. And so there was a lot of activity that first started in 2005 to amend the law. It ultimately, through various activities and things that Daniel will talk about, was an amended law was passed in 2016. Senator Lautenberg started the amendment process. He unfortunately passed away during this process, and the 2016 amendments were authored by Tom Udall and David Vitter. And so it was passed in 2016. The election happened in 2018, so the Trump administration had primary implementation authority of that law over the last 4 years. So now is the time that we can look back and see what did or did not happen in terms of how science was used in evaluating these toxic chemicals for their risks, which is required under the law, particularly for sensitive subpopulations, in order to understand what the risks are from the chemical and then be able to address them through the risk management process.
Great, thank you.
Awesome. And Daniel, I'm going to pass it over to you. Could you talk a little bit about Congress's intent with regard to the amended law that eventually passed with bipartisan support in 2016?
Sure. I think Congress's main intent was to, and they talked about it many times in hearings and in other venues on the floor and debates and such. They were really trying to address many of the problems that Tracy outlined with the original law. So the law had, under the original law, EPA had taken very little action to regulate chemicals, particularly existing chemicals. And Congress wanted to ensure that going forward, this would be a working, successful program. So they set enforceable deadlines for EPA to take action on evaluating chemicals, and they set minimum number of chemicals that needed to be assessed. So they set up a whole structure, sort of a conveyor belt almost, that was going to ensure that things actually proceeded and took place under the law rather than just stagnating. They also were concerned about the lack of information that EPA was acquiring and the public was getting on chemicals. And so they took a number of steps to ensure that there was more information gathered and disseminated about chemicals. They made it easier for the agency to require testing of chemicals by chemical manufacturers. They made it clear that in reviewing new chemicals, that EPA could not approve a new chemical for the market without ensuring that the agency had adequate information that the chemical did not pose an unreasonable risk. And they also required EPA to more thoroughly review claims of confidential business information. And then finally, and most importantly, my seat just went down. Finally, and most importantly, Congress wanted to ensure that there was more protection under the law. And they made a number of changes that strengthened the health protection of the law, including eliminating the consideration of cost when assessing the risk posed by a chemical, when evaluating a chemical, the requirement for EPA to focus on vulnerable populations, including children, pregnant women, communities, workers, to ensure that those populations were considered and protected under the law. They required EPA to address known harms from some of the worst chemicals, including asbestos, methylene chloride, and TCE. They strengthened the review of the new chemicals. They made it a more rigorous review of proposed new chemicals. And finally, they required EPA in evaluating chemicals to consider all conditions of use of chemicals. So EPA is supposed to consider all sources of chemicals and look at all the different ways that people might be exposed and consider all of those when evaluating the potential risk of that chemical.
So Dr. Coleman, as a research scientist who is formerly at US EPA and now at the University of Michigan, who's been observing, analysing and also commenting on the new TSCA since the law was amended, what did you believe the passing of that new law signified in achieving EPA's mission to protect human health and the environment?
Yeah, the 2016 amendments really mark a substantial change to the EPA's ability to protect human health and the environment. It gave the agency large responsibilities, and as Daniel was mentioning, new authorities to gather data and to be sure that that information is used to make affirmative risk determinations to protect potentially exposed and susceptible populations. And really, to create healthier environments, we really have to use the science to put people and their health right at the center of all of our decisions about chemical policy. So that's the challenge for EPA right now. So what does the law require EPA to do? So the law sort of sets out these ideas, and then the agency has to fill in the details of the implementation. So under the Lautenberg amendments for existing chemicals, for example, EPA is tasked with identifying high priority chemicals for evaluation, and they'd already started to do that before the amendments had passed. And after a chemical is identified as high priority, it triggers a risk evaluation process where EPA is required to use the best available science to make an affirmative risk determination and thinking about the chemical and all of their uses. Essentially to identify whether chemicals pose an unreasonable risk to human health and the environment. And after the risk evaluations have gone through public comment and have been finalized, then EPA is empowered to use its authority to make risk management rules to eliminate those unreasonable risks. So this is really important. EPA has some new authorities to require that companies who manufacture, process, or distribute chemicals in the US provide information about the safety of their products, especially the health effects among potentially exposed and susceptible populations, such as children and pregnant women, aging populations, and workers. There's a number of key scientific topics that need to be improved. The last administration had a lot of influence over the implementation of TSCA, and they made policy choices that were not always protective of health or in line with the modern scientific approaches, such as not aggregating all the different pathways that a person can be exposed to a chemical through drinking water, for example, and through inhalation, as an example. And it's not just the scientists who are weighing in on these issues. In March of 2021, the nonpartisan Governmental Accountability Office, or GAO, criticized the TSCA program as continuing to be a high management risk and urgent need of that pose risk as required. So I think one of those foundational issues are assessing the evidence through systematic review. And fortunately, we now have some National Academy of Sciences peer review comments to help guide EPA as it's making these necessary improvements.
Dr. Coleman, I might just ask one question. You mentioned aggregate exposure across pathways. Can you just explain what that means?
Sure. So the idea with across different pathways, oftentimes we're exposed to chemicals through a variety of different pathways. For example, a chemical might be present in water as a contaminant. It might volatilize and be in the air that you can breathe. It might be something that comes in contact with your skin. And so dermal exposure can be an issue. And so the idea is to add up all of these pathways. Also thinking about how we're exposed as different roles. So we might have occupational exposures on the job site. We might have exposures as a consumer where we're using a product. And we may also have bystander exposures just in the general population where other people may be using products that contain these chemicals.
I wanted to add something to that. Those were excellent explanations, Daniel and Trish. And I just wanted to say that one thing that's very important about the structure of the law is the onus is still on the government to identify and collect the data. So I think that represents an important challenge in implementation of TSCA. So for example, EPA has to decide, right now the way that EPA does this is they decide what data is missing for them to understand health risks, and then they have to go and get it. So the manufacturer or the chemical industry is not required to provide a certain amount of data. So this is both a time delay, but in the last administration, they basically didn't use their data calling authority, even though there were significant data gaps for most of the chemicals. They did it for one particular chemical, which probably most people haven't heard of because I didn't either, which was pigment violet 29. And when they did the data calling, they did identify that there were more risks to that chemical than they knew about because the data came in. So I think this having EPA having a approach that has identified what types of information they really need to make a good decision is a critical part of implementation, which has not yet been accomplished.
Yeah, thanks for that, Tracy. Definitely. And to follow up or round that out for pigment violet 29, even when EPA did request data from the manufacturer didn't actually provide the exact data that EPA had requested. They provided like a slightly iterative version, which kind of just shows like the way that the previous administration handled their data collection authorities. So we're going to kick it over to Justin. Justin is somebody with a history of EJ organizing and with a future in the legal profession. Can you talk to us a little bit about why there was a need to reform the original TSCA and its potential impact, the potential impact of the amended law on EJ communities?
Absolutely. I'll say fundamentally, the law wasn't sufficient for environmental justice communities for a number of reasons. Number one is the law is only as good as its enforcement. And so just knowing what chemicals are harmful or what the risk possess, but not being able to take it off the market or really get into the details to make sure that manufacturers aren't tweaking things and then sending out pretty much the same chemical. There are a lot of concerns that EJ communities have about just the lack of enforcement and the lack of government's ability to be able to protect people. I think secondly, the real cost of exposure hasn't been captured. There's a running joke in environmental justice circles that every new pharmaceutical drug or chemical will be accompanied by if you or a loved one has been harmed by XYZ chemical commercial 20 years later. And so we're not doing a good enough job making sure that the cost of these exposures from a maternal health standpoint is being captured. And then lastly, this was referenced a little bit earlier, but the burden of proof is impossible to meet for communities. Communities and government has to prove that chemicals are unsafe, and fundamentally that's a hard burden of proof for us to meet. And so the revisions were really needed. The previous law allowed for tens of thousands of chemicals to remain on the market without any review. It let chemical companies put hundreds of new chemicals on the market every year without making sure that they were safe. And it just gave companies wide latitude to claim that the information regarding their chemicals were trade secrets and hiding it from the public. So the amendments were really necessary, but there's still a lot of work that needs to be done on cumulative impact, making sure that the risk assessments that are done on a chemical by chemical basis has some understanding of the fact that people consume different types of chemicals on a daily basis. And so there's still a lot of work to be done to make sure that we're protecting environmental justice communities.
So Justin, just to clarify on cumulative impacts, it's, I guess, like an additive effect of different chemical exposures and other factors that might increase the potential of a deleterious health effect on somebody.
Absolutely. I mean, if you look in your kitchen and see, something that's containing PFAS, and you live in a home that has asbestos exposure, and you also are dealing with other chemicals on a daily basis, the amount of chemicals that you're exposed to are a lot higher than the risk assessments may predict or may assume.
Yeah, and I just wanted to add too that these are not scientifically new concepts, because the National Academy of Sciences has recommended to EPA account for cumulative exposures, and that having exposures to different chemicals at the same time can increase your risk to adverse health conditions. But EPA has not yet implemented that within the TSCA framework, even though we know people are exposed to, I don't know, dozens, many, probably more. We only really can measure up to 100 or 200, but we know that people are exposed to dozens of these industrial chemicals. So I think that's really an important point that the EPA needs to address if they're going to use the best available science to assess risk.
Great. Thanks, Tracy. Thanks, Justin. Thanks to all our panelists. Before we continue our panel discussion, we're going to play another short clip, this time from a CNN feature, A Toxic Tale, Trump's Environmental Impact, which actually features our program Reproductive Health and the Environment's work. And it's going to highlight the human impact of the Toxic Substance Control Act.
Charleston, South Carolina, the Low Country, home to beautiful beaches and gorgeous sunrises. The place where 31-year-old Drew Wynn started his cold brew business, Riptide Coffee.
He was an entrepreneur by the simplest definition. I mean, he was the American dream.
That's the smile that radiated, and that's the endearing smile that we all knew.
When people ask you about Drew, how do you describe him? What adjectives come to mind?
Gregarious. Industrious. I think the whole issue of methylene chloride and what it does to people that nobody understood, some people understood, the manufacturer understood.
Like most people, no one in the Wynn family had ever heard of methylene chloride until one tragic day in October 2017.
How did you find out about Drew?
Drew's business partner, Jimmy, was knocking out the door,
And he was hysterical, and he was just yelling. He's gone, over and over again. He had apparently passed out on Saturday while stripping paint from the floor. The first responders had to wear hazmat suits when they did the autopsy, and cause of death was methylene chloride inhalation.
This is the death certificate.
it is.
It says on here. It says it.
Yes. That's it. Cause of death, methylene chloride inhalation.
You don't typically see it that clear cut.
It was an ingredient in the paint stripper Drew had been using. You may have seen it yourself. Up until very recently, it could be found on shelves in most local hardware stores. Immediately after Drew's death, his brother dove into researching how exactly this could have happened. What he discovered shocked him.
This was identified 30 years ago. Some folks looked at this and said, this stuff is really bad. So it was really one of these things where you're like, how can this just be sold to folks and be used the way it is?
And Drew's not the first person. We know that there have been dozens of innocent human beings like him that bought a product off a shelf. That, oh yeah, if you read the fine print, which you can see in tiny little language, it says, be careful, don't use in closed areas, you've got to ventilate. If you don't read that, and then people die, and dozens have died just for doing everyday stuff with a product that is not necessary, shouldn't be sold to consumers over the counter. And EPA proposed that it be banned for that very reason.
Yeah, truly unbelievable. And methylene chloride is one of the first 10 chemicals that have been assessed under the first 10 chemicals by EPA, and we'll talk a little bit more about it in a moment. Under the amended TSCA, EPA was required to select the 10 highest priority chemicals for scientific risk evaluation, and they were to complete those risk evaluations by the summer of 2020, which they've done. EPA was also required to issue a framework rule that specified how it would conduct these risk evaluations. And EPA issued the final risk evaluation framework rule in July 2017. And as I said, they also completed the final risk evaluations for those first 10 chemicals last summer, which include dangerous substances such as asbestos, trichloroethylene, and also methylene chloride, which you just saw then. Dr. Woodruff, what were some of the key scientific decisions by EPA that affected how those risk evaluations were actually conducted?
Well, I think we covered some of them in the previous panel. There's been a lot of challenges in how they've conducted the risk evaluations. I think the fundamental part of this that's a little bit technical, but so critical to how the risk evaluations are done is that EPA is required to use a particular type of method that ensures that the scientific evidence is transparently and consistently identified and evaluated, which is called a systematic review. It's very commonly used. It's kind of the standard of use in clinical medicine to identify and evaluate science. The goal is to have a science evaluation of the science that is less biased because for various reasons you may go back and tweak things, and that's not really appropriate because you want to decide ahead of time how you're going to do the evaluation. EPA is actually required under the framework rules and as Congress intended to use a systematic review method that publishes their method ahead of time in a protocol that says this is what we're going to do to evaluate the science for this particular chemical, and then to use a consistent and transparent method to do the evaluation. However, in the Trump administration, EPA said they were using a systematic review method, but after a review by the National Academy of Sciences said that was not a systematic review method. It did not meet the standards of a systematic review methodology. It was not comprehensive, it was not objective, and it lacked a consistent approach for documenting and evaluating the science. And what this means is that what can happen is, and this is what happened in this, is that studies were evaluated and they were downgraded, meaning they may be a perfectly fine study, but because of the EPA's method, they either removed them from the risk assessment or they didn't evaluate them, or in some cases, we didn't even know what happened to the studies because the documentation was very poor. So the good news is that EPA did say that they were not going to use this method for evaluating the science. However, we're still waiting to hear what they're going to use. Fortunately, the National Academy of Sciences did recommend approaches for evaluating environmental health science that are readily available to EPA, including a method that was developed by the National Toxicology Program, the method that we developed, the navigation guide, which has been used by WHO and the International Labor Organization, and the method that's used in the Office of Research and Development at EPA under the IRIS program. So this is a really important element of this. The other thing that I think is another critical issue with how EPA evaluated risk is what Trish talked about, which is accounting for all the ways that someone's exposed. 1,4-dioxane, which is one of the 10 that you just said, that contaminates many drinking water supplies, some of them in Michigan. So people can be exposed to 1,4-dioxane in their drinking water and at relatively high levels associated with important health risks. EPA decided in that risk evaluation not to consider the fact that people were exposed to that in their drinking water when they were also exposed to 1,4-dioxane in their products. What does that mean? You get 1,4-dioxane in your body. You don't care whether it came from your water or your product. And what EPA is saying, well, somehow that, I don't know, 1,4-dioxane just didn't happen, but it did. And that was also another flaw. They also didn't really fully account for sensitive subpopulations, which I think Trish is going to talk about a little more.
So just to understand, Tracy, if you took out that exposure pathway of water and there was 1,4-dioxane within water, but you're not accounting for it, to me that would mean that you're going to grossly underestimate what the true exposure level and risk is to that chemical.
Right, and so you're like basically adding all these different features that are kind of in each of their own way, leading to some type of underestimation of risk. And then ultimately, you're not really going to capture the risk. So you may not even say that a risk is unreasonable, and then you can't go to the next stage, which is managing or removing that risk. I think just to go to the point about methylene chloride, since EPA did propose a full ban of that in the Obama administration, which was rescinded in the Trump administration and then partially implemented in the Trump administration, but not fully, there's a substitute for methylene chloride. We've done a study showing that people die from methylene chloride and they don't have to. And since the Obama administration announced their ban, 4 people have died from methylene chloride exposure. It's just for no reason. I mean, that's just not the way the law should be implemented.
Yeah, absolutely, Tracy. And I think definitely no matter what, at the end of the day, the reality is that people are exposed to chemicals in these myriad ways, and whether or not EPA is able to account for them properly under the amended law is really what is at hand here. So people are being exposed irrespective of actually how the law captures them or how EPA captures them. Daniel, I was wondering, what were some of the strategies for the chemical industry as far as TSCA implementations, and how would you categorize them? Were they successful?
Well, I think the first and maybe the overarching strategy was that they put themselves in charge of EPA. The chemical industry lobbyists and lawyers and scientists were put in all the major senior positions at EPA, including the ones having to do with EPA's toxics office. So they were in charge. They essentially ran EPA for 4 years. So what we had was implementation of TSCA by Dow and BASF and DuPont, and that did not go very well. Certainly not for the American people. So once they were in charge, they did a number of things, some of which we've already talked about. They dropped or reversed the policies that had been proposed but not finalized by the Obama administration, most notably the ban on methylene chloride in paint strippers, which cost 4 people their lives extremely tragically, including Drew Wynn. Just as an aside, they did the same thing on organophosphate pesticides and shelved the proposed bans on chlorpyrifos and pesticides and flea collars. So it was all toxics under that office that was being run by industry. As I think Trish mentioned, they adopted policies that were clearly at odds with the statute, not considering exposure from drinking water and air pollution and contaminated soil, ignoring the vulnerable populations that they were supposed to be considering in evaluating the chemicals, and presuming that all workers had 100% personal protective equipment, which is completely ridiculous. Things like that would lead to weaker assessments of the chemicals that they were required to assess. They also very regularly bulldozed the career staff at EPA. They required agencies to concur with decisions made by the TSCA office, even when they didn't agree with them. They directed scientists to make changes to their evaluations of chemicals, which were not called for. Some of those are being investigated now. And similarly, they ignored the recommendations of the National Academy of Sciences, and there's a scientific peer review panel established under the law. That panel reviewed each of the 10 risk evaluations that EPA drafted for those 10 chemicals, and the panel doesn't give letter grades for those. Their reports did not contain letter grades, but if they had letter grades, they clearly would have been Fs for all 10 of those. And EPA never made changes to address the problems raised by their peer review panel because they didn't want to do better risk evaluations, because that wouldn't have benefited the chemical industry. Finally, I would just say they also were pursuing a broader anti-science agenda at the agency, also, written and promoted heavily by the chemical manufacturers, including the purge of independent scientists from the science advisory boards, and pursuit of the so-called censoring science rule, which was designed to make it much harder for EPA to use epidemiological studies in evaluating chemicals. So those were, that's not even the whole list, but they basically took over and showed total contempt for every other stakeholder that was engaged in the process, and pursued their essentially agenda to exonerate all toxic chemicals to as much as they could get away with.
Yeah, I find it quite incredible that we could have people from the American Chemistry Council in the Toxics Office implementing a law that's meant to be protecting public health. I find it mind-blowing. Dr. Coleman, I have a question for you. Tracy touched on what the public health consequences have been for how these risk evaluations have been implemented so far. I'm also interested in understanding how the definition of potentially exposed or susceptible subpopulations that Justin mentioned at the start of our discussion today what it meant by EPA, I guess, defining that in a way that was different to how it was initially intended to be defined. Could you talk a little bit about that?
Sure. So defining the particulars of potentially exposed and susceptible populations is one of those important features that EPA is putting forward as they're implementing TSCA. And they originally proposed one definition and then finalized a different definition, as Daniel referred to, during a different administration. And although it kept to the letter of the law potentially, it didn't really do what was needed to fully assess all of the potentially exposed and susceptible populations. And so trying to understand what these chemicals and their exposure mean to sensitive populations is crucial, because that's where you might see the risk occurring first and with the most adverse effect. So the video clips that we saw earlier talk about pregnant women. So that would be an excellent example of how chemical exposures in utero, for example, might have lifetime consequences for a person over their life course. And so understanding that very particular point of chemical exposures could be the vital thing to understand overall risk and being sure that we're protecting all people as the law requires. So that's why getting these definitions right is so important. Also, TSCA is giving new authorities for protecting workers. So chemical exposures in the workplace is one of the first places we often see the effects, also because of the high levels that are potentially present. But you can also think about the modern workplace where women and pregnant women may be working side by side with others. And so understanding the consequences for workers, especially when they may not have the ability to advocate for the protective engineering controls that they need or the equipment that they might need to protect themselves, is also really an important occupational justice issue as well. I would also just say that I think that from the community perspective, the amount of time that all of this wrangling is taking means that they're just continuing to be exposed. And again, we saw the clip on methylene chloride, and that's an acute effect, but the chronic exposures that continue are kind of a silent crisis that we really need to bring forward and do something about.
Yeah. Thank you, Trish, so much for that. And, I'm glad that you wrapped up with that last point, because Justin, I did want to kind of identify or ask, how did EJ communities or folks in Midwestern states or other states like Michigan receive this new law and its implementation? And, what is the impact of the EPA really failing to aggregate the exposures or consider these cumulative impacts of these chemicals for folks on the ground?
Right. So I think overall there's frustration. I think environmental justice communities need results, and we need to know that the EPA is working every day to address the daily life impact that people are going through. So there's certainly concern about what we don't know. So there's frustration that communities have to prove that they've been harmed. There is frustration that in order to get one of the most harmful chemicals off the market, there needs to be wide outrage and condemnation from the public, researchers and journalists. And if that's the standard, if that level of public outrage is what's required to get bad chemicals off the market one by one, then we're never going to get to the point where our communities are safe from the thousands of chemicals that need to be reviewed and that pose a risk for us. I think there's also concern about government's responsiveness in the face of operators and businesses who don't care. Certainly there are capacity and funding issues when lobbyists with unlimited funding and financial interest to fight every attempt at regulation are facing, the EPA, which is undermined with budget cuts and sabotage every 4 to 8 years. There's also just, again, concern that companies have been hiding for years chemical formulas from scrutiny, from public scrutiny, and that the EPA just doesn't have the capacity to make sure that these companies are being held accountable and being called on that lack of transparency. And on your point of just the impact of failing to aggregate the exposures or consider cumulative impact, I think, it was mentioned earlier, I think hit right on the nail. that there are implications for workers. Certainly, this is a workers' justice issue, making sure that our workers are safe when they go to work, that people don't have to take 2-3 showers when they go home because of the chemical exposures at their workplace. But also, there's certainly public health implications that aren't just implications and impacts that we're facing right now, but that may be seen decades and generations from now, certainly when it comes to impacts like birth defects and maternal health. So there are real day-to-day, every life impacts of failing to do what the science requires that I think we need to consider.
So looking forward, Dr. Woodruff, what can US EPA do from a scientific standpoint to put forward more health protective risk management actions, considering the deficiencies that we've been talking about in these first 10 risk evaluations? And perhaps an equally important question is, what other scientific approaches could they use moving forward with the other high priority chemicals that they're going to be evaluating that can fully quantify benefits in the rulemaking that are going to adequately protect the most vulnerable, including these EJ communities that Justin and Trish were talking about?
Yeah, so first of all, I want to say the tools are all there. EPA can do it. There's not anything new.
I think we might have lost Tracy momentarily there. Trish or Daniel, do you want to, anyone else would like to respond to that question about what they can do moving forward in the risk management process?
Is that the tools are available. The tools are available and EPA needs to be using them. Likewise, it's really important that they make steady progress forward. We have a lot of chemicals on the list and a lot of communities that have been waiting a long time to be sure that this primary prevention has been done. There's certainly methods that are available to do a better job on systematic review that Tracy talked about earlier. This is the way that we bring together streams of evidence in a systematic and transparent way. So you may have animal model data, you may have human subject data, you may have other types of advanced information, and you need to bring all of those streams together and make sense of them. And so a systematic review is something that we've been using in clinical medicine for a long time, and we need to be using that in environmental health sciences as well. So I think we've got the tools that we need. We need to be applying them, and we need to be talking to communities. Especially in the Great Lakes area, we have a lot of experience with a variety of situations that we need to be sure that the concerns that communities are bringing forward are considered.
Tracy, welcome back.
Sorry about that. You know, when we're at home.
The wonders of modern technology. Dr. Coleman kindly.
I just wanted to say that.
But yeah, I'll pass you.
I just want to say that the thing is that the tools are all available. EPA can do it now. I think the other thing that's really important is, and this I think goes back to what Justin was saying, which is so critical, is that these communities are suffering, or people are suffering from health effects, and EPA's ability to actually account for them in the risk assessments is not being done. So, and these are for all those health effects that are not cancer. So things like respiratory effects, neurodevelopmental effects, obesity, diabetes, birth defects. EPA can actually quantify how much is related to the chemical exposure. And that would actually, that number provides the ability for EPA to figure out the benefits, that they can communicate back to the community. Right now, they have this vague method that just says maybe you have a little bit or a lot, and that is meaningless. So I think the important thing is that EPA can actually use the tools that have already been developed to provide more data and information. That's not the only thing that's going to protect communities, of course, but it does help put information about the real harms that are occurring from these exposures to chemicals. And that is, it's a kind of a technical thing, but a really critical thing, because otherwise government officials can continue to say, well, we don't know, when they could actually know. And I think the other thing is there's also methods to account for cumulative exposures and to adjust the risks so that they account for these vulnerabilities that happen when you live in a community that's more highly impacted from exposures or other factors, right? Poverty, food insecurity, racism and discrimination, all those things could be accounted for and because those things can increase stress and then increase your risk to a toxic chemical exposure, those things could be accounted for in some way in the risk evaluation that then feeds into the final management. But of course, when we say this, it's like a lot of process. So EPA, I believe Daniel Wright, EPA has authority that they could act now, even on something like methylene chloride, should there be an imminent risk, danger.
Yeah, can I ask the glaringly obviously question then, Tracy, which is why are they not implementing these methods if they're available and validated?
I don't know yet. I'm hoping that they will reveal that. I think that it could take training. I'm hoping that this administration will look to this as an opportunity to upgrade the science and use the best available science. But some of those things are best answered by EPA.
So I wanted to add that there's also new authorities to gather data, and that EPA can begin in advance so they have enough time to do the longer term studies that take a long time to get funded, to get approved, all of those things. And so they're not limited to just the 10 chemicals under active evaluation right now or the next 20. They can really be looking ahead and trying to fill the data gaps that's been a 40-year process in the making or longer.
Yeah, definitely. Go ahead, Tracy.
Yeah, I think the scope of the problem does seem large, because it is large, and that's because TSCA hasn't been fully functional for, since 1976. So, I mean, there's a big job that they have to do. EPA has to do, no question, and it's going to take, unfortunately, some time. And the way the law is structured, it does take time to do this. So just again, I think that the EPA does have authority to call for data calling, and they do have to do the risk evaluation, but it is under EPA has to deal with this, right? It's not on the manufacturers to provide this information per se, as Justin said.
Yeah, perfect. So Justin, I wanted to kind of move over to you now that we're kind of talking about the current administration a little bit. How can we ensure that EPA is in line with the Biden administration's executive order on ensuring racial health and racial equity and health equity through its actions?
So I think a couple of things. The first thing is urgency. So whether it's racial disparities on cancer and asthma rates or birth outcomes and reproductive health for folks in environmental justice communities, I think the Biden administration has recognized that people have been waiting and feeling these impacts for way too long. And so we need to shift the burden of proof from communities having to prove that they've been harmed, along with researchers and journalists. We need to move with urgency, and we also need to recognize that the exposures and harm felt by communities is systemic. I think secondly, and practically what is needed from the EPA is getting out into the community. And that doesn't mean just holding a hearing to let people know what the decision is. It means visiting frontline communities, of course, but incorporating and believing and trusting that the communities that are being impacted are experts. It means hearing the stories that we've heard from the clips today and realizing that every story that we hear about one specific chemical and one specific death or harm or health impact we're facing is something that we're also facing on a much wider scale that just hasn't been uncovered yet. And then I think lastly is worker protections. I think this intersects the Biden administration's commitment to workers, but also to making sure that racial justice is being centered. Many of the workers that are protected or that are not protected by labor unions or who work in more informal workplaces or economies, these workers also need protections, and these workers are oftentimes disproportionately Black and brown. And I do just want to recognize that there has been work that's been done by labor unions working with folks at NRDC and Earth Justice and other environmental groups who are fighting for their own health and their own protection. And I think the EPA, in line with the Biden administration's commitment to labor unions, to workers, to racial justice groups, can accelerate that commitment and can really stand in the gap in making sure that our communities are safe.
Yeah, thank you, Justin. And it does really highlight how important it is for, particularly, we're discussing TSCA today, but for TSCA to be treated comprehensively. In order to actually address racial equity and health equity, we need to see TSCA comprehensively rather than see it as piecemeal.
Absolutely. Daniel, what can be done to strengthen implementation of the law? What's within EPA's powers to strengthen TSCA and make this whole evaluation process more sustainable?
Well, I think Tracy and Trish and Justin have hit on some of the things. They have the tools they need under the law, and they've had them at least since 2016. They just weren't being used. So now those same authorities that Congress provided in 2016 and mandates, not just authorities, are there to be picked up and used. And I would say, it's too early to say much, but the administration has announced some changes they're making and some new policies they're adopting that, depending how they're implemented and carried out, are very encouraging. So I'd say the early signs are positive on things that they're intending to do, but certainly reversing course on the issues that people have talked about, the assumptions about worker protection, not considering environmental exposures when evaluating, evaluating the chemicals, their previous failure to account for vulnerable populations that we've talked about. Those are all things that they can, they can do tomorrow or today, and hopefully have already started doing. They can certainly get more serious about filling the data gaps, like Trish talked about, and developing a cumulative impacts analysis, which I think both Trish and Justin talked about. I just want to say there's a particular category of chemicals that is regulated or is not currently very well regulated at all, not only under TSCA, but under other laws, and that's PFAS chemicals. And those were singled out by Congress for attention because the previous administration did virtually nothing to address the PFAS crisis, and it actually took Congress passing requirements as part of their Defense Authorization Act, their annual Defense Authorization Act, to compel EPA to use the tools they already had under TSCA to take some steps to get more information for the agency and the public about where PFAS are in the environment and how they're being manufactured, et cetera. So the previous administration, even while they were technically meeting the deadlines that Congress passed, they were taking other steps to weaken or undermine what Congress wanted them to do. So it was a good early sign that the new administration is moving forward with some of those restrictions on PFAS, which is extremely important. I would just say that the main thing that they need to do, and they certainly have the authority to do it, I don't know whether it's going to happen or not, but I think there needs to be a change in the sort of the perspective of EPA's Toxics Office and maybe the agency more generally. And I really think the most important thing in it, an overarching thing with all these other concrete things we've talked about, is they really need to stop treating the chemical industry like a partner, acting as if chemical industry is a partner, which is how the chemical industry continually talks about things these days. Oh, we should all work on this in a partnership, and we should all work together to make TSCA work. But that's completely inconsistent with how the industry has acted in the past 4 years and really the past 40 years. And if the real change to protect environmental justice communities and workers and vulnerable populations is going to take place, EPA is going to have a fairly significant cultural shift where the chemical industry is a stakeholder, but they're not a partner. And they're, frankly, I think the public would be better off if EPA had a somewhat more adversarial relationship with the chemical manufacturers than they have had over the past 4 years and historically.
Yeah, absolutely, Daniel. I think that's a great
Tracy.
Tracy.
Sorry, Tracy's hand up.
Yeah, well, I was just thinking about what you're saying, Daniel and Justin, because it's really important that the Biden administration has announced, and actually written into, executive orders that about health equity and environmental justice, and they've made this a priority in the administration. And I think there has been, I think we've participated in this, some attempt to open up and talk about environmental justice, but the big challenge is the environmental communities are not or communities are not resourced at the level to participate in these activities. Like, the industry has a lot of resources, so there has to be more active ways to resource these communities or other groups to participate in these issues in a way that can bring, because I think EPA, they're in DC, they have to listen to, they hear what people are saying, but they can't really hear everything. They need to go, either you need to go out actively into these communities, and they need to resource communities so they can be at least level the playing field a little bit.
Yeah, and Trish?
Yeah, I was just going to say that the EPA does have, its regional offices that have relationships with community groups, with state and local governments, and clearly in the process by which the TSCA amendments came forward, many states and local governments moved ahead with their own areas of control and have expertise that should be tapped. So, I would agree with Tracy that the EPA has the tools that it needs to do some of this work. And as Justin said, they need to really meet people where they are.
Right.
Yeah, exactly. And I think even following up on that point, Trish, and kind of onto Daniel's point as well, and Tracy's point, that EPA and the Biden administration have stated this commitment to health equity and have stated this commitment to racial justice. And I agree with Daniel, it would behoove them to have a more adversarial relationship with the manufacturers, because as Justin was saying earlier, it's critical that if we're going to commit to environmental justice in a material way and in a real meaningful way with financial backing, we have to trust community expertise. And I think it's really critical at this juncture for EPA and the Biden administration to disrupt the cycle of failing to listen to Black and Brown people who are facing these experiences, up front, and asking them to please come to their offices instead of going to meet them, when every day people are just trying to survive. And you can't ask that of people who are just trying to survive.
Yeah, an excellent point, Swathi. We have some questions coming in from the audience, so we might ask the panelists questions that have come in. Justin, you've actually got a question regarding what Washington DC could do, or sorry, rather, do you see any signals in Washington DC that more sweeping substantive policy change is possible? In particular, are any policies being considered that holding manufacturers more accountable for public health effects?
Right, that's a great question, and I don't know. There are, I think, positive signs when you look at things like the PFAS Action Act, which passed the House, when you see action that is rumbling on things like burn pit exposure. So there are actions on an individual basis on different exposures that workers and communities are facing. But there's still a lot of work to be done to make sure that the response is systemic and that the response is not on a one-by-one, chemical-by-chemical basis. I will say that, whether it's tobacco industry or the effects of climate change, throughout our history, we faced lying and suppression of data from certain stakeholders. But we've also seen things like seatbelts and the removal of lead from paint and other consumer protections that come about when people are engaged and when people are pushing government to be more responsive. So I think it is possible. I think we still have a long way to go to make sure that the burden of proof is shifted away from communities and researchers and journalists and government and onto industry, proving that what they are producing is safe. But I do think that the engagement and the work that we're doing today and the work that's been going on over many years is helpful in getting us there.
Yeah, excellent. Okay, our next question is for Dr. Woodruff. So today you focused on existing chemicals and haven't really talked about new chemicals. So what is the prospect for implementing a chemical management program in the US similar to the European Union's REACH program, in which industry must prove a chemical safe before it's put into commerce? And what are some of the best features of the European approach, kind of building on what Justin was just talking about?
Well, I would say that, so just to kind of fill that out a little bit, what you were saying, Swathi, is that in Europe, all chemical manufacturers are required to provide a certain amount of health and safety data in order for their chemical to stay on the market. And it's been shown to, so a number of chemicals that we use in the United States have been banned in Europe in part because of this law. And there's ways to use them, et cetera, but I won't get into the details. So we think that that's a good, at least baseline model for should there be certain types of information, like a completeness criteria, set a list of information that EPA should require in order to be able to fully evaluate the potential harms. You could do it for the existing chemicals, but that would be also useful for the new chemicals program. And I'm just going to give one other minor detail that may seem obscure technically, not to the scientists on the call, but that is actually critically important. And that would be, you could even require things that allow us to basically test the chemical or measure the chemical if it's out in the environment or in people's bodies. So one of the things that EPA doesn't require right now is something which is called an analytic standard. So it's basically the chemical that's been made, so the chemical industry has already made it, that comes in a solution so that people could use it to measure that chemical either in, whether you're like looking in water or people's bodies, or you could use to test it. EPA doesn't require that now, but it's critical if we're even going to be able to understand or monitor, should we regulate these new chemicals, where they're going and how they may be affecting health. So it's even like very basic things that EPA could require as part of their new chemicals that would really start to help shift the information source onto the industry, providing certain information if they want to be able to have their chemicals be used and really us being exposed to them. So I don't know, Daniel, if you wanted to add anything about the new chemicals program.
Well, I'm so glad you brought up my favorite topic, Tracy, which is analytical standards. That was
We can't have a call with this without talking about analytical standards.
I'm glad we get to wonk out in front of hundreds of analytical standards. I mean, the best current example of the need for that, again, is the PFAS crisis, where, you know, EPA has the ability to identify, I think it's about 29 PFAS out of the hundreds at least that are around.
9,000. There's 9,000 registered on EPA's dashboard.
Right. So how many of those are in the environment? How many of them are in our water, our soil, our air, and products, our food? We don't really have a handle on that, in part because EPA hasn't had the analytical standards. Again, the last administration did nothing to use their authority to get that. And it's interesting, under FIFRA, the pesticide law, pesticide applicants do have to provide an analytical standard when they want a new pesticide, when they want to introduce a new pesticide. So EPA has quite a full repository of pesticide analytical standards and virtually nothing on the TSCA side. So that's a very great example of a, like you said, a kind of technical in the weeds thing, but would have huge importance for EPA, not just the TSCA office, but the water office, the air office, being able to really get a grip on PFAS, and then any other new chemical. It should be required for any new chemical. I completely agree.
Yeah, I was going to say we work with a researcher who tests chemicals in a yeast system that's a model for reproductive health effects, and we're trying to purchase some of these chemicals, and those PFAS chemicals that people are exposed to, you know, is difficult to find because, like you're saying, they don't even necessarily allow people to purchase it, even though we may be exposed to it.
Yeah. Daniel, what about a political pathway to reforming TSCA to the European REACH standards that Tracy was just talking about? Is that something that would be possible?
No, I don't actually think that's too likely. I don't think Congress is going to get into reforming TSCA in a big way anytime soon. I mean, I think for the Congress, there was a extremely heavy lift to reach the consensus that they did finally reach on that, on the Lautenberg law, and in a proverbial sense, there was a lot of blood spilled over those compromises that were made, and I don't think they're likely to revisit it anytime soon. I actually think, you know, there's a lot of progress that can still be made at the state level, that, as Trish was saying, that can supplement and go beyond what TSCA provides. And then I actually also think, relating to REACH, something that we all need to watch out for. You know, historically, the U.S. has been not helpful for, you know, has been sort of, has been unhelpful as far as stronger laws or requirements such as REACH in Europe. And they've different administrations have tended to carry the water for the chemical manufacturers and pulled strings and levers to weaken things like REACH as they were being developed in Europe. So we really need to watch out. And I'm not asserting that the Biden administration will do that by any means, but it's going to require all of us paying attention to what's going on in trade policy and other things where these things might come up, just to make sure that the U.S. is playing a positive role worldwide on in various fora and not a negative role that they've often played in the past.
Thanks, Daniel, so much. Trish, I wanted to pass to you because I saw that you had a lingering thought, but I also wanted to ask you about the fact that some states actually have programs to reduce toxics, like Washington State, for example, has a great program. So what's at stake for them?
Yeah, I think a lot is at stake for the states. The Lautenberg amendments really concentrated a lot of the decision-making power at the federal level. And that may seem like a great idea until you understand that perhaps the most health protective scientific use of data is not occurring at the federal level, that there's a risk there. So it's important that states and local governments pay attention and participate in these decisions as they come forward, to be sure that we're protecting vulnerable populations. I wanted to go back to one of the other issues about the international affairs, which is ISEE is one of our sponsors. And on the science side, these are global issues and global scientific issues. And so that's a variety of these professional science associations can play a key role in helping us to understand and to compare and contrast what's working, what's some of the best practices. And so that's a really important thing going forward, as we think about how this particular TSCA legislation compares to other approaches across the globe.
Great. And Trish, I also just wanted to follow up back on these states and their programs under the amended TSCA. There is an incorporation in TSCA that kind of preempts state actions. Can you talk a little bit more about that?
Yeah, that might be something Daniel would want to talk a bit about as well. But the idea is that as EPA prioritizes chemicals and begins the risk evaluations, it preempts states or puts a pause on their ability to move forward on their own. So although there's some ability for states to continue with things that are on the books, it does also create a situation where states aren't going to be able to move forward on their own. So I don't know, Daniel, if you wanted to add to that.
That was one of the compromises made in the final law that I think many groups did not support that. It ended up in the final law. I mean, I would say that one thing that's interesting to me about that is that was a major thing that the chemical industry wanted was that type of preemption. And that part of the trade-off was that states' right to know programs, laws and right to know programs, the Washington State and California's Prop 65 and other existing or future right to know laws were explicitly carved out and protected from preemption. And the ink was barely dry on the Lautenberg law before the chemical manufacturers came up with a new piece of legislation to try and preempt and take away all of those right to know laws. So it's kind of another example, important example, I think, of just generally the bad faith of the industry coming out of the compromise that led to the Lautenberg law. And that's also reflected in how it was implemented when they were in charge of EPA.
Well, I think the other thing about this too is that because any actions that EPA takes on the regulatory side will preempt states on those uses, and that's why EPA's authority is much greater, right? Because that any decisions they make, states can't decide that EPA didn't use the right science, or they didn't totally account for all the vulnerable populations in their state, and the state wants to do something stricter. They're not going to be allowed to do that. So that just makes the focus on EPA and their ability to use the best available science to implement TSCA so extra critical.
Absolutely agree.
Yeah. Amazing. Thank you both for that. So we are now moving kind of into our closing. So for each of the four panelists that we have here, I would like you to imagine that this panel reconvenes 5 years from now, maybe. In an ideal world for you, what would have happened? What are some of the most important elements of an improved chemical policy? And let's take it in the order of Justin, Trish, Daniel, and Tracy.
I think for me, coming from a environmental justice organizing background, the number one thing that I think needs to be prioritized is communities being treated as experts and being trusted. Sorry about that. And being trusted when we say the chemicals that we're being exposed to is having an impact on our everyday life and on our health. So I think that manifests its way in a number of ways. It means the cumulative impact of chemical exposure being taken into account. It also means, the EPA being more aggressive and meeting communities where they are on the ground. And I also just think it means making sure that, again, that communities are not having to carry the burden of proving that the chemicals on the thousands, whether it's PFAS or other chemicals, proving that they're harmful.
Trish?
Yeah, so I think I would want to agree with what Justin is saying. I think that's a really important point. Also, from a public health standpoint, we want to be preventing bad outcomes. We don't want to have bad outcomes and then trying to fix them. We want to prevent them in the first place. This primary prevention is so important. And that's what TSCA is supposed to be doing for us. So, my hope for the future is that the expected outcome would be primary prevention, and that we would have health and environmental justice and equal protection of the laws as the key expected outcome, that our science would be used in such a way to make that happen, that data would be developed in a timely way to be able to have those calculations made, and that instead of what we saw in the video where these families are struggling and doing these heroic things to get something that should just be routine to happen, that instead that EPA is really doing its best to move forward.
Well, first of all, I'd say the 5 years flew by and everybody looks fantastic. So congratulations on that. None of you have aged more than 3 minutes. I completely agree with everything Justin and Trish just said. And just to add on top of that, I think, ideally the use of PFAS will have been eliminated other than the most critical and essential uses. EPA will have taken, very meaningful action to ban or significantly reduce the use of the chemicals where they find an unreasonable risk, including asbestos and methylene chloride and TSCA and 1,4-dioxane and others, that the communities and other vulnerable populations are really being protected, and the exposures that are causing unreasonable risk are being eliminated, that the Toxics Office and the agency generally has really updated its science to step into the 21st century and be using the methods that the National Academy has recommended quite a few times, and that there's really a move toward jumpstarting a movement toward actually safer alternative chemicals, and not just a continuing endless, march of regrettable substitution, one flame retardant and one PFAS at a time, and just a real systemic move to a much better place that would benefit the population, the public for sure, and ultimately those parts of industry that are willing to, take that step and produce those safer chemicals.
Tracy with the caboose.
Wow, it's really hard to follow all those really excellent comments because I agree with all of them. I think ultimately what we need is that EPA is using, as Daniel said, upgrades their science, that they focus on preventing these harmful exposures. So while we focus a lot on the existing chemicals program, it's really in the new chemicals program where there's going to be a lot of opportunity as chemicals are being, identified and phased out that are risky, that we deal with the new chemicals program so that we really only the chemicals that are not going to be harmful to the public or are getting onto the marketplace. And EPA has a really important role. The government has a really important role in incentivizing prevention and production of chemicals that are not harmful to the public. And I think that these are really important things. I've seen in 5 years that all the recommendations that everyone said came true, and that we haven't aged more than 3 minutes. So it could be the best part.
You say that like you haven't been doing this for like longer than 5-year increments at this point.
Oh yeah, I definitely want to make sure we get together and say, look at all these amazing accomplishments that have happened, and it could happen. We are all here, so
totally happen.
Great ideas and lots of science and organizing. So.
Yep. Yeah, a very big thank you to everyone, to all our panelists for an excellent and thought-provoking discussion. As we said before, this is the 5th anniversary of the Lunenburg Amendments, and these past years have certainly given us lots of lessons to reflect upon, and we appreciate your thoughts today to discuss some of those lessons. Obviously, in the coming 5 years and hopefully the foreseeable future, it's critical that we help EPA to implement TSCA using the best available science to reduce exposures to these toxic chemicals in our environments. To prioritise fence-line communities, workers and communities of colour in order to achieve its mission to protect human health and the environment. So once again, a really big thank you to you all.
Yeah. And I also want to do a thank you to Detroit Public Television and to our co-sponsors, the International Society of Environmental Epidemiology, North America chapter, who helped make today's discussion possible.
And finally, for anyone watching today, if you'd like to stay informed on this topic, you can access our public comments and also our blog on the Program of Reproductive Health and the Environment website. You can also follow us on Facebook and Twitter, where we'll continue to inform the public on TSCA implementation. Again, thank you very much to our panelists, and have a lovely weekend to everyone.
Thank you.